Hello everyone, I'm Steve Savant, syndicated financial columnist and money color commentator. On today's show, the ABCs and Ds of Medicare, part 5 in our series on managing your retirement. You know, I have to say, once you cross over to 65, one of the greatest things, if you have to grow old, turning 65 in our country is pretty good to deal. Because now I left Obamacare, right, at $1,000 for myself and my wife every month just to cover our basic issues. And we don't even have a history of needing medical care. So we're blowing a couple grand a month trying to stay in Obamacare. The moment I turned 65, it went from $1,000 down to $134. I mean, that's huge savings for Plan Part B. My wife the same way. So when you think about a married couple, most married couples for their Medicare B are paying $134. If you're paying more, it's because you signed up late for Medicare. And boy, what an issue. Listen, even if you're already being employed past your 65th birthday, I'd be signing up for Medicare Part A for sure. Because you, if have gainfully employed and you like your employer, but most employers, you could cut a deal. Your employer's probably paying you $10,000, $12,000 paying your premium. If you want on Medicare, he may be able to give you a sizable bonus to stay on and have you switch over to Medicare. It's way cheaper for him, better for you. You get an increase in salary. That's what I would do. Part A is going to take care of all of our hospitalizations. The moment you sign up, when do you have to sign up? They're going to give you a space in time, 3 months before your month of your birthday and 3 months afterwards. Don't delay. There are penalties for not signing up in time. And believe you me, depending on how long you wait and you don't address this issue, it can be punitive. So remember, Medicare is there for you. Let's work the system. Let's remember, 7-month window to sign up for Medicare. So if you're born in halfway through the year, let's say July, you're going to have 3 months before July and 3 months after July. And in that month, you got 7 months to sign up. Is it hard to sign up? No, it's pretty straight up and easy. If you need somebody to escort, you can call socialsecurity.gov and they'll put you on with somebody and walk you through the sign up process. Don't miss the deadline. Now, even if you do miss the deadline, there's a little bit of things that you can adjust, but really stay on it. You want to be able to make the deadline work for you. So 3 months before, 3 months after, if you don't do this right, you could have a problem. Part A is hospitalization. Part B is optional insurance that covers medical services such as doctor bills, equipment, tests, preventative health care. But keep in mind, that's our $134 payment. Part B doesn't cover everything. Some people look at a Medigap policy. Maybe it'll be a Cadillac plan where they pay $150 to $200 a month per person and they have no other bills, no deductibles. It's just flat fee, paying a high Cadillac premium, and that's what it is. Some people pay a middle ground, maybe $75 to $100, and for the cheap with a higher deductible, this is again covering for this area that Part B doesn't pick up. Now, some people use Medicare Part C. Now, this is just me. You don't have to do this. Just in Arizona where I live, my wife and I have been very blessed our 43 years of marriage, and we have had very little issues in hospitalization, sickness. We've been very good health as boomers, and I'm thankful for that. We had an election where we didn't have to pay any premiums for the subsidy of Medigap, but we are on the hook for this year, $4,900 worth of any expenses that happen that are into not hospitalization, but any other issues that we would have, because we're not paying any premium at all. Now, last year we paid no premiums. We only had to use our Part D. I'm going to get to that in a second. So I thought it was a great deal for us. We have good history, good health history. There's no reason for us to pay additional premiums above and beyond the $134 for a Medigap policy when they're giving us a Medicare C contract. I like that. I thought it was a good deal. Now, Medicare Part D. Listen, you have to have continual coverage all the way up to the time you ask for this. If you don't, you're going to get a penalty. Now, I looked at it and said, okay, I have Obamacare. But if I didn't have Obamacare and I didn't want to pay that extra premium of Obamacare and I didn't have coverage by my employer, the Part D regulations are going to say you didn't have continuing coverage. So I said, well, what will that number be? And I figured it out. It was like I'm going to be penalized my first 2 years in at $9.90 a year. Now, I just want you to think about that. Should I pay the $1,000 Obamacare or should I pay the whole year of $9.90 penalty? Doesn't make sense to me, I paid the penalty. But remember, there is a penalty on Part D. You don't want to keep drifting and making this happen. And remember, Medicare is premised on most Americans. It's $134 for this Part B. But I want you to know that the more money you make as you go up the tab in your adjusted gross income, that could be exposed to you. There are people paying for Medicare at $200 and something a month. Twice the average of most Americans, because they still make great money. Their adjusted gross income is huge. But guess what? They were coming from Obamacare, which is $1,000 or whatever it was per person, dropping down to $200. It's still a great deal, except for your adjusted gross income could make a difference here, and your $134 could be twice that a month, depending upon how much money you made. So is it a mean-tested program, a means test program? It is. And do you have to buy Medicare? Depending upon your state and what they offer, look at your health. If you have health problems, if you've had health problems all your life, don't do the Medicare C scenario that I described. We were healthy, we were okay with that, and we felt we were good about exposing ourselves to $4,900 a piece in expenses if we were wrong. But you have to be at a place where if you have issues, you need to get a Medigap policy that picks up where Plan B leaves off. Don't short yourself in retirement. Next to taxes, medical care and long-term care are the biggest expense you're ever going to have in your golden years. I want you to always think, this is a good deal, and I want to make sure it stays a good deal for everybody. And so when you're looking at your total package for the ABCs of Medicare, I want you to look at all the things that Part A and Part B do. In Part A, you can have hospitalization coverage. It could be semi-private room, meals, skilled nursing home, hospital services, blood transfusions, inpatient care in psychiatric facilities, 190-day maximum in a lifetime, and necessary Medicare-approved professional home care. Remember, when I say professional Medicare home care, this is not a substitute for long-term care. This is a very short and small benefit. It's a good benefit. It's necessary, but you cannot use that as your long-term care. I promise you, the benefits run out so fast, you'll barely understand it. Maybe it's good for a very short period of time, but you'll want to look at your ability to secure a long-term care policy. My wife and I both have our own policies. We're paying those premiums. Every time I have to write the premium, I kind of wince. But if anything happens and I need assisted home living, my contract's going to cover, and it'll cover me for care at my own home. Remember, Part B covers introductory full exam. Every year I go in for a full exam. I went and got the flu shot. It cost me nothing. It was great. I mean, I walked in, lab tests, durable equipment such as walkers, wheelchairs, mental health care, occupational and physical therapy, preventative services such as cancer screening, EKGs, and certain shots, as I said before. This is really great. So when I got in front, I just went up there and said, how much do I owe you? Nothing. I have a small medication, a little bit of lisinopril. It cost me, I think it's $9 for 90 days. Unheard of. So remember, you can also get generic drugs. Walmart, some of the grocery stores that have pharmacies attached to them, they're all selling generic drugs. You need to learn how to work the system to your benefit. And remember what it doesn't care. And I'm just going to say it the way it is. Dental and vision care, they don't cover it. Now, my HSA account, which I've been saving for hospitals, supplemental care, my savings account, I use that for my dental and my eyes. And I've worked out some senior strategies for this. But Medicare B doesn't cover any of this. So you really want to take care of yourself. Remember, one of the things that are directly connected is good dental health and cardio health. When I first heard this, I thought that was absurd. How could your teeth have anything to do with your heart? But it does. So you want to keep your teeth in good shape. And one of the places you're going to spend your actual HSA, your health savings account, that area of dental and vision in your senior years. Remember, you can also, for your HSA, you could pay your Medicare premium out of it if you wanted to. Now, many vaccinations that are ancillary that you want, maybe HPV or something like that, you have to pay for that. And healthcare outside the U.S. If you're traveling, it's not going to cover that, so you need to be aware. Do you have to buy a short-term medical coverage for yourself if you can get it? And you want to be able to do that so that you can have the possibility of whatever you're going to do in overseas. If you got sick, you're covered. And then lastly, just keep in mind that original Medicare, deductible copays, premiums, Part D. Fee-for-service plans are there, but I like basic A, B, C, and D. A is my hospitalization. B is my normal visits to the doctor and shots and exams. see if I can afford not to, if I don't have to pay a Medigap premium and my state allows it, I like it, and I'm willing to pay the $4,900 if I'm wrong. And Part D, Medicare drug, pretty inexpensive. So think about it. This area is an area that you need to know and manage so to keep your healthcare costs down during your golden years. I want to thank you for watching our series on managing your retirement. And keep in mind, before moving forward with any of the ideas on our show, always check with your tax consultant, legal counsel, or financial advisor. You've been watching Steve Savant's Money, the name of the game.